Okay, so this time we're going to talk about the skeletal structure of the pelvis. So just kind of for your own mapping, in your own head, what I want you to realize is that the pelvis is at the base of the spine, above the lower limbs. So that's something that we really need to be aware of, and we tend to forget about, is that the pelvis here is where the lower limbs attach onto the torso. And it's a really important thing to realize and to remember, because all of the forces that go from the lower limbs have to be able to translate through the pelvis, okay? So we need to remember that part of it. Now the pelvis is also the structure that holds all of the weight of the abdominal organs, supports the abdominal organs, as well as the reproductive organs down at the base of the pelvis. Now, skeletally speaking, the pelvis is made up of this large bone here. We've got one on either side. And this large bone is actually made up of 3 different bones embryologically. So as you're developing in your mother's uterus, this is actually 3 separate bones that come together to fuse and make one bone. So at the top here, this wing-like structure is called the iliac bone. Down at the base here is called the ischial bone. And at the front here is called the pubic bone. Now those 3 bones come together and they fuse to create what we call the innominate bone. Now the point where they fuse the most, I should say, is right here at this circular and concave structure. Now in Stan here, he's got this metal contraption coming out of it. However, in our bodies, we don't have that. So this structure here, this concave structure, is actually called the acetabulum. And the acetabulum is almost like a cup that the femoral head from the lower limb will come into. And that structure there is what we tend to be referring to when we speak of the hip socket, okay? So the hip is actually this connection of the femoral head into that acetabulum. Now, if we come around to the back of the pelvis, we have this wedge-like structure. And this wedge-like structure is actually called the sacrum. And the sacrum is made up as well of fused bones, and it's made up of fused vertebrae. So if you look above here, you can probably see those spinous processes of the lumbar spine. They're quite large and robust in the lumbar spine. However, down here on the sacrum, all we can kind of see is these remnants of those spinous processes. And then down at the base of the sacrum is a smaller structure. It's almost reptilian in its looks. And that's called the coccyx. We usually refer to it as the tailbone, but its anatomical name is the coccyx, and it is also made up of fused vertebrae. Now, if we look here at where the sacrum and the innominate bone connect, this joint here, we tend to call it the SI joint, or sacroiliac joint is its correct term. And then we turn around here, and between the 2 pubic bones, so we've got one pubic bone coming in this way, one pubic bone coming across that side, and in between the 2 of them is the pubic symphysis. And the pubic symphysis is also a joint. And then just above the sacrum there, we've got the vertebrae coming in and beginning to stack one on top of the other to create that spinal column. Now, we're looking at some of these bony landmarks in our bodies, areas that you can probably palpate on your own body. At the very front here of this iliac crest, so this big bony ridge is called the iliac crest. And the very front of it is called the anterior superior iliac spine. We tend to refer to it as the hip pointers. So at the very front there, hip pointers, or the ASIS, anterior superior iliac spine. Now, if you follow that iliac crest all the way across to the back, we also have a posterior superior iliac spine. And again, you can likely palpate that on your own body if you reach around and just kind of feel wide of the sacrum. There tends to be this kind of little knob there, and that's going to be your superior, or your posterior superior iliac spine. And then down at the bottom of the pelvis here, you're going to feel that those sit bones that if you sit on a hard surface, you can feel them quite easily. That's actually called your ischial tuberosity. And it's quite a robust structure to support the pelvis. And then around at the front here, if you're comfortable palpating it on your own body, is your pubic symphysis. And you can actually follow that pubic bone all the way across to the ischial tuberosity if you're comfortable kind of following along on that ridge there. Now, one more landmark that I just want you to be aware of, because we are going to be talking about the muscles that are around this area in a little bit here in the next session, or one of the next sessions, I should say, is this almost window-like structure here. And this is called your obturator foramen. Obturator foramen, okay? And again, I just want you to become aware of it so that when I'm referring to it in future sessions, when we're talking more about the muscular anatomy of the pelvis, that's just going to be a little bit more familiar for you, okay? So again, the structural anatomy of the pelvis, it's quite robust. It's made up of multiple fused bones. And there's a few different joints. We're going to talk about those joints and the movements that are possible and maybe not so accessible to us in our yoga practices. I'll be talking about that a little bit more in the next session.